In the category of illnesses, there are two major groups: acute illness and chronic illness. Chronic illnesses are long-term illness that usually develops slowly. Examples of chronic illnesses are cancer, asthma, dementia, HIV or AIDS, and more. On the other hand, acute illnesses develop suddenly and last a short time, often only a few days or weeks. Some of the examples of acute illnesses are asthma attack, a broken bone, flu, heart attack, and so on. Both of these types of illnesses can be extremely deadly. Dealing with these kinds of health problems is very important. In most cases, there are three stages when coping with these illnesses. The first stage is when the patients worry about their future and feel sad and disappointed. This allows quick anger to flourish into their minds, targeting themselves as well as their loved ones. However, in the second stage, patients start to acknowledge and understand a lot about their illness, which helps patients feel in control. They can understand their illnesses often through doctor's appointments and researching on their own. In the final stage, patients feel comfortable with their treatments, such as inhalers and shots. It is natural for every patient to take as much time they need in order to come to feel more comfortable with their chronic illness, and therefore all kinds of emotions will appear in that person during the coping process. Lastly, taking control of current health conditions are very diverse, some of them being identifying emotions, understanding other people's reactions, keeping things in perspective, and playing an active role in healthcare. Patients' first instincts are to be constantly sensitive and begin with crying in order to help let their sadness out. This often leads to mental health problems, but many people go to therapists and close people instead, such as family and/or friends, for support to deal with illness. Understanding other people's reactions is another part of taking control. However, people tend to get offended by people's reaction, which can also lead to mental health problems. The third type of taking control is keeping things in perspective, keeping up with their original daily lifestyles. Finally, the last type of taking control is playing an active role in healthcare. Being honest while having an appointment with a doctor so that they can retrieve the correct medication will help understand the illness better. And asking themselves different questions, such as how the situation will affect them, how they can prepare in order to receive treatments calmly, and what they can expect from the treatments is a very important factor in finding ways to appeal to their stressful situations.